Breast MR has multiple benefits that apply to our patient population, and it depends upon the kind of women that you're looking at. First of all, and perhaps most importantly, we're using it to screen women who are at elevated risk for breast cancer. And these are women who have at least a 20% lifetime risk of developing breast cancer. Currently, that accounts for about 60% of the population that we are screening. We also use it importantly in preoperative staging for some women with breast cancer. I think it's particularly valuable in that group in women who have positive margins after an initial excision. Secondly, in women who have a diagnosis of invasive lobular carcinoma, because we know that our staging with other modalities is not very good, and MR is pretty accurate in that situation. And thirdly, I think it should be strongly considered in women who have a diagnosis of ductal carcinoma in situ, which is of the non-comedo subtype and has an index lesion that's 2 or 3 centimeters in diameter. We know we are very poor at staging the extent of disease in those women. So those are the primary patients in whom we are using it. There are other less usual situations in which we'll apply MR, and those include some problem-solving situations, more commonly in women who present with positive axillary adenopathy and other random cases. When we started our breast MR program, there was a concern about access of the technology to patients, and secondly, there was a real concern about whether or not an additional workup would delay surgery in patients who had a diagnosis of cancer. We've tried to address those issues in a variety of ways. Firstly, we have expanded the availability of breast MR services. We currently have 3 magnets that are available for breast MR in our breast center. Secondly, in order to improve the speed at which care is being delivered, we read our breast MRs online as they're being done, and patients who need any additional workup, except for MR-guided biopsy, patients who need any additional workup get that workup the same day as their MR. So we have obviated the delay in the delivery of cancer care, and we've improved the availability of services with an increased number of magnets that are available.
Breast MRI is the most accurate test for diagnosis of breast cancer. It's extremely important for our patients, and in fact our waiting time is so significant that not always our patients are able to receive prompt service. Breast MRI is extremely important in preoperative setting to assist for our surgeons in surgical planning, and breast MRI is the most accurate test for breast cancer diagnosis in women at high risk. Breast MRI commonly allows us to provide more accurate service, and it allows us to solve serious clinical problems which are impossible to solve with conventional breast imaging as mammography and ultrasound. Breast MRI is the fastest growing segment in MRI examinations in North America, and number of breast MRIs continually increasing in Ontario. Unfortunately, current number of our magnets and magnet time for breast MRI is insufficient in order to provide prompt service, and it's especially important for patients with newly diagnosed breast cancer. There are many patients with personal history of breast cancer and at high risk of breast carcinoma which will not have breast MRI as it currently suggested by guidelines of American Cancer Society and Canadian Association of Radiologists.
About how can we improve the delivery of MRI? Is that something you can speak to right now? Go ahead.
In order to improve our services, we need to get more magnets and to get more radiologists trained in utilization of breast MRI.
Go ahead.
So this morning I spoke about some of the technical issues of optimizing breast MRI. Basically, I spoke about some of the issues that are necessary to deliver the kinds of improvements in sensitivity that we've been able to see with a number of clinical trials. So these include the need for proper breast coils, bilateral imaging, the use of T2 weighted and dynamic T1 weighted pulse sequences with some form of fat suppression, and the needs for appropriate choice of resolution both in plane and through plane in order to get optimal imaging. Bilateral imaging is mandatory in order to do modern imaging, but the basic message I think I wanted to deliver is that it is a robust imaging technique that's been shown in several studies throughout the world to be very effective at improving the sensitivity for breast MRI. So if you look at the notes that I have associated with my talk, you'll be able to look at some of those technical issues and adopt them for your own purposes.
Really, say the question. Go ahead.
So the question we might consider is, what will the future of breast MRI be, and how might it evolve in the coming years? And I'm very optimistic about some of the things that could happen with breast MRI, with different pulse sequences and different techniques for reconstruction and the development of different contrast agents. So while breast MRI has been around for on the vicinity of 20 years, I think we're still very much in the mid-domain of its evolution, technical evolution, and I look forward to seeing significant advances in the years to come.
Breast MRI is a very useful tool, and it's been proven beyond doubt that it has a high impact on management of patients in those particularly who have been diagnosed with breast cancer. MRI is a very good tool for staging of these patients. It helps us detect additional disease which can impact patient management in up to 27%.
Hold a second. Question? What is the benefit of breast MRI to patients and referring physicians?
Breast MRI is a very useful tool in patients who have diagnosed breast cancer. It gives us additional information about additional foci of disease, contralateral disease, involvement of the lymph nodes and other structures, and this is a very, very important information which the physician needs to have and the patient needs to have so that they can decide what kind of management can be chosen for the patient.
So how does breast MRI impact the delivery of service to patients?
Well, breast MRI is very important, particularly in patients who have breast cancer. Unfortunately, not all patients are able to have this service right now because of the availability issue and also issues with the availability of MR-guided biopsy for these patients. So even though we would like all our patients with breast cancer to have preoperative MRI, right now we are not able to do that because of these factors.
Let's start from the top. So what is the benefit of breast MRI to patients and referring physicians?
Breast MRI is a new modality that's revolutionizing breast imaging. It's allowing us to find cancers that we could not otherwise find using mammography, ultrasound, or physical examination. And this is helping the referring physicians to better able to determine the extent of malignancy before they get treatment.
You want to say the last sentence again? Because that was a good one. It was a grammatical thing there. The benefit of MRI
Okay.
to referring physicians.
All right. MRI is also helping the referring physicians by showing the extent of malignancy so they can better treat the disease.
How does breast MRI impact the delivery of service to patients?
So MRI, because it allows us to find cancers that we can't otherwise find, is allowing earlier diagnosis of breast cancer so that the treatment will be simpler and the prognosis much better. In addition, because we have limited access, it can actually delay the final treatment of the breast cancer because women are waiting to get their examinations. Okay. Sometimes MRI can actually delay our delivery of service because women have to wait to get their MRI examination preoperatively. Okay.
Go ahead.
All right. Currently, the Ontario government does not fund MRI guidance for biopsies of MRI-only detected lesions, and this is totally irresponsible.
Consent. Smiling the whole time.
This is Derek Marodali. I give the OAR consent to use this video.
Keep talking. Keep bringing it a little higher. There, about there. You look good. You're looking fine. Fine specimen.
There you go.
Come on.
He's even dressing me, this guy.
There, look at that. Regular GQ.
There you
Derek, take 2. Go ahead.
This is Derek Miradali. I give the OAR consent to use this video. Hi, I'm Derek Miradali, and here at the OAR we're going to be organizing a breast ultrasound course in April 2011, primarily to discuss the role of ultrasound in all breast imaging departments. As you all know, ultrasound in breast imaging has taken off over the last few years and our referral bases have increased substantially. The course will be focusing on differentiating basically benign and malignant lesions, but also on finding those lesions that we often miss on ultrasound and can be liable for missing. We're going to focus on ultrasound as a multimodality approach to solve problems in mammography and in MRI, and use ultrasound overall to preoperatively assess patients with breast cancer. Also to use ultrasound as a modality for assessing the postoperative patient, the ones that look well, the ones that we have questions with, and overall to solve all problems with. I hope you join us for our course. We hope it to be a very informative course, and we think that it'll be quite a progressive course, and we look forward to seeing you in future.
Brilliant.